What's the diagnosis in this case, Gayatri?
Ma'am, this is a case of sepsis with septic shock using Q-SOFA score.
Now, Dr. Gayatri, come out of 2021 sepsis guidelines. According to the latest 2026 sepsis guidelines, though the presence of Q-SOFA indicates the possibility of sepsis, it is poorly sensitive for the diagnosis. According to the latest 2026 guidelines, News2, News or CIRS is preferred over Q-SOFA as a single screening tool. Among this, News2 has the highest sensitivity.
And how do we decide about fluids and vasopressors in such cases, ma'am?
So, in fluid resuscitation, fluid-induced hyperperfusion or septic shock, you should give IV crystalloids 30 ml per kg within the first 3 hours of sepsis onset. If the patient's BMI is more than 30, weight-based fluid calculation should be done. Your balanced crystalloids is preferred over normal saline to avoid hyperchloremic acidosis and AKI. But if there is sepsis with traumatic brain injury, normal saline is preferred. If the hypotension persists after the fluid resuscitation or if there is unstable septic shock, you can consider giving vasopressors along with the fluid resuscitation. It can be given peripherally if there is a delay in securing the central line. It can be given in the order of norepinephrine, vasopressin and epinephrine, or you can give dobutamine if there is associated cardiac dysfunction. Gayatri, can you tell me about the antibiotic policy as per the previous guidelines?
Yes, ma'am. According to previous guidelines, we used to give antibiotics within 1 hour of presentation after sending cultures.
Yes, you're right, but there is something new here. There is something called definite sepsis, probable sepsis, possible sepsis. Definite sepsis, where there is sepsis, is highly likely based on the history, clinical examination, and diagnostic testing. Probable sepsis is something where there is moderate suspicion of sepsis, and possible there is less likely suspicion of sepsis. For definite, probable, and possible sepsis with septic shock, antibiotics is recommended within 1 hour. For possible sepsis without septic shock, antibiotics can be delayed even up to 3 hours. Yes, as far as cultures is concerned, it should be sent before antibiotics, and earlier it was supposed to be 2 cultures, and now according to the latest guidelines, 1 culture is enough. And please note here, if you want to give beta-lactam antibiotics, continuous infusion is preferred over bolus doses. Follow the page for part 2 regarding guidelines on respiratory support and other additional supportive measures. Thank you.